Around Wichita Falls, folks are finding longer and longer wait times at medical care facilities. Some have reported a wait time of 2 hours or longer at walk-in clinics, and that's, of course, only getting longer. Josh Hoggard joins us now with more on this.
Yeah, Daryl, today I spoke with a local healthcare official about that very issue, and the answer to why times are longer may not be as shocking as you might think it would be. It's the most wonderful time of the year, but nothing can dampen the holiday spirit quite as quickly as an illness. Making matters worse, however, is the wait time at local clinics.
It's the season of cold and flus, and a lot of people have developed infections, and when they run a fever, they get worried.
Dr. Keith Williamson is MSU's medical director, and he says that with the amount of illnesses going around right now, the amount of people seeking care isn't all that surprising.
We're seeing a whole mix of viruses, primarily influenza is what's bringing people in. There's also circulating RSV, the respiratory syncytial virus, which is a bad cold in adults, but a serious illness in the little guys with the little airways. There's also adenovirus, rhinovirus.
Not to mention,
COVID is still circulating, and I think we should count our blessings that it's not the same lethal disease it was 2 years ago.
But none of these illnesses are new, so why the extended wait time at walk-in clinics? Dr. Williamson says it has a lot to do with the extraordinarily high number of flu patients.
The weird thing is the flu started about a month and a half early this year. That's far earlier than I usually see it. I had a day about a week and a half ago, 100% of the patients I saw, every patient I saw all day had flu.
So with the flu already impacting so many Texomans, on top of your typical seasonal viruses, it's the perfect storm. Dr. Williamson says the best way to avoid those long urgent care lines, stop the flu before it can start.
We should get vaccinated. The flu vaccine is out there, it's available, and it's effective.
Another tip to avoid catching anything this cold and flu season? It's as simple as applying what we already learned during the pandemic.
Wash your hands frequently, avoid crowded places. If you're sick, don't go out in public and don't go to work or school until you've been fever-free for 24 hours.
And to help keep those wait times down, make sure you're only seeking care if you really need it.
Most of the time, unless you've got difficulty breathing, chest pain, any sort of life or limb-threatening symptom, you can handle your symptoms yourself. Get the box of Kleenex, salt water gargles, Tylenol or Advil, and you'll be all right in a couple days. If you're not, if you're running a high fever, or if you've got difficulty breathing or any of those symptoms, that's when you go seek physician's care.
So it looks like as long as these seasonal illnesses are circulating around Wichita Falls, those wait times are going to stay. But with a little proactivity, we can help keep our community well, and we can reduce those wait times.
Wow. Well, if that flu shot is effective this year, I know a lot of people will be glad they got that. Okay, Josh, thanks so much.